Good evening. Today is June 4th, and today I'll continue to talk about the coronavirus. So the first piece of news that I'd like to talk about is that while doctors battle COVID-19, many others are worried about another looming global public health threat, antimicrobial resistance. 700,000 people die each year because medicines that once cured their conditions are no longer effective, and this happens when bacteria or virus mutates, creating antimicrobial strains, and soon as if the virus or bacteria is mutating faster than pharmaceutical companies can make drugs, then essentially it will become a superbug in which there are no drugs that can cure it, and it is being extremely harmful. It is going to be extremely harmful with absolutely nothing to stop it. Health experts are warning that the same government inaction that allowed the coronavirus to spread worldwide could lead to an even deadlier epidemic of drug-resistant infections as the pipeline for new drugs run dry, which is basically stating that new drugs are not produced as quickly as pharmaceuticals. As for pharmaceutical companies, the only way that they will start to develop a drug is if they can profit off them, but companies haven't yet to find a way to profit off them, and that is the result why drugs are not being produced as quickly as perhaps they were. And antimicrobial resistance is extremely dangerous in that there's nothing to stop it, and the bacteria can only just kill more people with absolutely nothing to stop it. So I think pharmaceutical companies really should start to develop a drug. Maybe the government can help by bringing competition to it so that pharmaceuticals companies could work harder, but I feel like this public health threat may be even worse than the pandemic. The second thing that I like to talk about is that there has been an increase in about many ways that you may be feeling off, and that is not a result of having COVID-19, but a result of living during a pandemic and living through the stress that it is causing you. So today I'll just talk about some of the most common symptoms of being overly stressed, and some of these bodily disturbances could be psychosomatic, but since information about how COVID-19 the disease affects the body is still incomplete, it's not irresponsible for patients to worry that the virus might be behind what they're experiencing. So it may be good to worry, but just don't worry too much. The first symptom is that your blood flow may be changing, and ever-present stressors can create serious physical effects, such as sending chemicals and hormones in our bodies that release epinephrine, also known as adrenaline. So our bodies take that and shunt all the blood in our bodies toward the main vital organs, such as the brain and the heart, and the blood ends up rushing away from our extremities, and the result is basically like tingling fingertips could be a sign of stroke, or it can signal that blood is flowing normally again when you're being pulled away. The shunted blood flow will also be responsible for psychological factors, and it can also shut off the feelings of pleasure and desire. The second thing that it can impact your body is that you might have gastrointestinal problems, and persistent stress could be due to changes in diet and exercise, and any changes in what you eat can lead to complications in how you digest it, including nausea, cramps, and diarrhea. And if you're exercising a lot less, it means that your bowels are not moving as they normally would, which can lead to constipation. And so the best way to treat this is just maybe return to a diet or go to a healthier diet and exercise more. The third thing that is affected is that skin diseases like eczema or psoriasis, and people will and such as these skin diseases will be showing up more frequently, from hand washing or stress, and hormonal change. This is caused by hormonal changes prompted in our bodies from stress. People who don't normally suffer from these conditions are also developing rashes called dermatitis, which isn't necessarily caused by genetics, but by outside factors. And the skin under your rings is especially prone, as that can get wet during washing, but the ring might not be removed during drying for the skin underneath it to be dried off. So these rashes can tend to be itchy and annoying, but you can also leave gaps. There are also gaps in the skin that become prone to infection. So that was just basically a summary, and if you have any problems, I feel like you should go to the doctor. That's it. Thank you for listening, and I hope you have a good day. Thank you.